Gestational diabetes is a form of diabetes that occurs during pregnancy. It typically appears by 24 to 28 weeks of pregnancy in people who did not have diabetes before. Of all metabolic disorders of pregnancy, gestational diabetes is the most common. It leads to high blood glucose, also called blood sugar, due to the body's inefficient production or use of the hormone insulin. Without the proper insulin production to manage glucose levels, your cells cannot get adequate fuel from the glucose and they start to malfunction. This lack of insulin causes your cells to break down fat and muscle for energy. Worldwide, gestational diabetes affects about 1 in 7 people during pregnancy, though this number varies by region. 1 in 14 people is diagnosed with gestational diabetes in North America and the Caribbean, whereas 1 in 4 people is diagnosed with gestational diabetes in the Middle East and North Africa. Gestational diabetes requires extra caution and careful monitoring to prevent drastic changes in blood glucose. The fluctuation in glucose levels can cause your baby to grow very large. Gestational diabetes also increases the risk of your baby's shoulders becoming stuck inside your pelvis during birth. Due to complications like these, you may need a C-section. Gestational diabetes can also increase your risk of conditions like high blood pressure, hypoglycemia, and thrombosis. After birth, your baby is at an increased risk of low blood sugar, also called neonatal hypoglycemia. Neonatal hypoglycemia is the most common metabolic disorder in newborns. Gestational diabetes may also increase the risk of your child being overweight and developing diabetes. Since 1 in 2 people with gestational diabetes will eventually develop type 2 diabetes, maintaining a healthy lifestyle is also essential postpartum. Regular exercise, dietary change, insulin, and oral medication can help keep blood glucose levels within the recommended ranges. Depending on your symptoms and test results, your healthcare provider may initially recommend trying to control your glucose levels with dietary changes and exercise. Making these lifestyle changes may be easier if you involve your partner or family. People who have gestational diabetes with uncomplicated pregnancies should aim to achieve 30 minutes of moderate exercise daily. Moderate exercise includes activities such as brisk walking, gardening, bike riding with light effort, and swimming slowly. Dietary changes involve changing the quality and quantity of foods that one consumes. The ultimate goal is to reduce poor maternal and fetal health outcomes caused by high blood sugar after eating. If changes to your diet and exercise routine do not help you control your glucose levels after 2 weeks, your healthcare provider may recommend insulin therapy or oral medication. Monitoring your blood sugar regularly will help you learn how to keep it within a normal range and minimize any side effects. Watch out for signs of high blood sugar like thirst, headaches, difficulty concentrating, blurry vision, weakness, fatigue, yeast infections, and frequent urination. Comparatively, signs of low blood sugar include hunger, headaches, dizziness, shaking, confusion, sweating, mood swings, a fast heartbeat, and paleness. Contact your healthcare provider if you struggle to control your blood sugar. They may need to change your treatment or adjust the dosage of your medication. Go directly to your nearest emergency room if you feel confused, lose consciousness, or find it challenging to stay awake or wake up. If you were recently diagnosed with gestational diabetes, know that there is no right way to feel after receiving your diagnosis. People may experience a range of feelings like shock, fear, guilt, or failure. Everyone comes to terms with their diagnosis differently. It's important to know that with proper care, you can still have a healthy pregnancy.